Hey guys, welcome back to your channel Dr. Battisi, and I'm your dentist Dr. Jasmine. So here we are with part 2 of dental scams. That is like scams happening in dentistry. So this today we are going to talk about scam with dental patients. In the last video we talked about scams with dentist, and there is part 3 also coming up. So guys, this is very important video for all the dental patients out there. You have to be, the first one is you have to be very careful. I have been to very many clinics, and this video is really important for you. First, whenever you visit a dentist, you have to make sure that the dentist is certified dentist, degree hai, then it is registered, the dentist is registered with the state council of India. It can happen like the registration might need a revision, like renewal, but at least that dentist should be registered. Number three, the clinic must be registered. And every year the clinic is renewed. Sometimes the process takes long for the renewal. So at least the clinic should be registered for once. So sometimes it's like it's in the process. But at least these three things should be there. Otherwise, what happens is lab technicians, the dental lab technicians or the assistant who help the dentist, who is truly an backbone of a dental clinic, sometimes when they are into long dental practices like 11 years, 10 years or more, or maybe even less, they open up their own clinic and they hire a fresher dentist to, like a dentist who is certified, like just completed BDS, a fresher one, and they make him sit there, work there, and it's their clinic. It's totally wrong. Just because patient wants to save few rupees, please don't do yourself such a thing, because in our clinic nowadays we are doing a lot of re-RCTs because patient wanted to save money and they went to some quacks, and now we have to do the retreatment. And what they do is like they do the filling with the denture material, which is so wrong. They do the wrong diagnosis, they do treatment which is totally temporary and totally wrong. RPD, removable partial denture, which is made to be put and removed. That is, they fix it, and that too with the wrong material. I have seen in clinics, certified clinic. This is I'm coming to verified dentist, where you know there are two types of filling material. So they do one filling material, but they charge for the other. They charge for the more pricey dental material, but they're doing the lesser one. So you have to be very careful. I'm not saying that don't be aware, be educated, be aware, Google or whatever research you want to do, but make sure and keep that in mind that you are not a doctor. Even I am a dental surgeon, I'm not a physician, I'm not an ENT, I'm not a gynae. Of course I know the basic medical things, because in BDS most of it is taught, but our focus remains on head and neck. There will be another video coming on detail about dental surgeon. We will discuss that in that. And I have been to clinics where there was a very start, like first month of the clinic, and I thought the sterilization machine would be coming now 3 months gone, there was no sterilization machine, there was no autoclave, and I was doing cleaning the instruments just with a normal cleaner solution. That's it. It was not sterilized, and I had no say to the dentist, because I can only say to the dentist, but I had a job to do. I mean, like, I did not know, I was a fresher then. I did not know what to do exactly. There are a lot of marketing scams going on of famous celebrities promoting them. I'm not naming anything. Maybe in another video I would. So these are scams. The Dental Council of India hasn't said that you can do dental scans, scan your teeth at home and do the treatment for the same. You need a proper orthodontist guidance, and orthodontic consult, pictures, and a lot more for a dental treatment. And just some clear aligners or invisible braces cannot do that. There is a proper notice with that. And guys, I have been to clinics where I was handling the clinic independently, and there was an assistant who had 10 plus more or years of experience, and I was into dentistry then till 6 years. So, I was new to the clinic, so a patient sat in front of me, and she was in 60s or 70s probably. So she had two implants, lower left. And when I took the x-ray, I just saw in one implant. I was so confused, like, of course there were two. I can see the one, where is another one? And from the back, the assistant is, giving me isharas, or making me understand, like, do not say that there is just one implant. And I was so shocked. I was like, yeah, x-ray seems okay, but I cannot, I could not understand, because I do not know the case. Maybe there was something, but patient knows that there are two implants, but in x-ray I can see only one, and patient doesn't know that she only has one implant. And that came as a shocker to me. So, and guys, you must, there are very much things that the patient must understand. There is no guarantee warranty in dental treatment, in any treatment for that matter. So why they ask for guarantee warranty? The dental labs give some, there are some conditions applied to it, but still nothing can replace a natural tooth. If you can, destroy a natural tooth, how can you expect a dentist to give you warranty on something that is artificially made, or something which is replica of natural but not natural? And you must understand that every profession has plus and minuses. Every profession has the best and the worst. I'm not saying all dentists are bad. I'm just saying that these are things happening. Just be aware. And what I have experienced, so I'm just sharing my experience as well. I had made a video on the rights of a dental patient, like the question they must ask. So I will link down below. Please see that video. And guys, there is, sometimes we are not able to trust the patient on payment. So there should be a mutual trust, because I have been in the clinic I'm currently right now. It's like we have consulted many patients, we have taken the x-ray, but they haven't came back. They never paid the consultation fee. So that is, I would blame me for that. I mean, I will blame ourselves, our clinic for that, and not the patient. But that doesn't mean, it's like the trust is broken. So please at least pay for what the work is done. At least pay for that. And guys, there are dental surgeons where, like, if something is done, like sometimes when we do an RCT, the thing that we put in the tooth, sometimes it gets broken, and it's very it's normal, guys. And if, of course, every case varies, but it is something that must be shared with the patient. It's a responsibility of the dental surgeon, because that's his body or her body, and they should know what is happening inside their body. And it is completely normal, but you know at least the dental surgeon should have the courage to say to that. At least be honest, so that you can have a good night at sleep, at night. And it's like, then the patient must also understand, if something, like in dentistry, the aesthetics matter so much that we have such a huge pressure. If you're operating on your stomach or any inner part, then you are giving the general anesthesia, like you don't know anything. In dentistry, we give you local anesthesia, so you can see everything and you can comment on. So to be a dental surgeon requires a high responsibility. It's like huge thing sitting on here. And still, if a patient can do good, trust me, you are amazing. I'm talking to you as a dentist to a dentist. So please be an understanding patient from the dental part. We understand a lot. You have all the rights to question. You have all the rights to access your data, the details, everything. But please understand us also from our part. Then there are fake reviews. Like, if we have opened up something, or if there is something, of course we are going to share it with our friends, family, patients we have been in touch since long. Of course they are going to be the ones who are going to review first, and that too, of course, good reviews most probably. But we cannot force. And there are fake reviews as well, like paid reviews and something like that. Please don't go for it. I'm talking to you as a dental surgeon, and as a to a patient also. There are fake reviews also, but it is normal if we are sending it to our friends and etc. That is okay. But the paid reviews, or just fakeness, this is genuine, this is something natural. If you open up something, you share it with your in a community, but don't go ahead with the fake reviews and forcing reviews. And I really hate this, to be very honest, when a dental surgeon bad mouths about other dentists. If he or she is a quack, if you confirm, then you can, straight away say, because quacks need to be like under control. They should not and cannot practice. But bad mouthing other dentist is totally wrong. What you can say is, now this is the current scenario of your tooth or of your oral cavity. Now that you have come to us, this is going to happen, these are the options, choose. This is the right way. You cannot say like this was done by him, etc etc, or her, and this was wrong or whatever. Just say. And this is something which I learned very early in my career and by an amazing mentor I had. So please, I want to spread this message for that. This video specifically is a message to share that there should be a mutual relationship between a dental patient and a dental surgeon, because we are nobody without you and you don't have anybody without us for the dental treatment. So please, let's have an understanding. Many patients are awesome, I'm not saying that, but just understand us from a point. You have all the rights, and just be, understanding about dentistry. It's changing since I have graduated that scenario, and now it's way better, and I'm quite sure it's going to be getting a lot of better. It's just a need for an understanding. We all are humans, we all need each other, so why not walk together and grow together. So guys, see you in the next video, which is like the third part and the last part of the scams in dentistry, and that actually happened with me, like the other two videos, but that actually happened with me. See you soon. Stay tuned. Bye.